Not everyone needs the same treatments, so we customize your treatments to best suit your needs. So acne scars have always been traditionally difficult, and in the distant past, people would have very aggressive, sometimes more traumatic and not necessarily effective treatments. We've actually advanced a lot, especially in the last few years in terms of acne scar treatments, and we do a lot of different things now to address the many different kinds of acne scars that people have. Some of those things include subcision, excision, radiofrequency microneedling, filler and fat placement underneath the scars, just to name a few, and as well as TCA cross for those ice pick ones that can be traditionally very difficult. We use a combination approach to really accomplish what you need to accomplish for your individual acne scar needs. So the wonderful thing about coming here is we have a lot of physicians who are doing this, who have different kind of roles in it, and we all contribute to making you look the best that you can be. So we have many different technologies that we use on many different types of acne scarring. For things like red marks and dark pigment marks, we'll use lasers, a number of different lasers, to create that more smooth, even complexion. Radiofrequency microneedling is what we use to create a smoother complexion for people who have more uneven texture. Radiofrequency microneedling is different than traditional microneedling in that it has radiofrequency depositing thermal energy at the depth of the needles, as well as the mechanical injury from the needles themselves. So what that does is amplifies the results that we have and the rate at which you will see results, and gives you the smooth complexion you want more quickly. So during these laser and radiofrequency microneedling treatments, we're creating little micro areas of injury, and that micro injury is what stimulates your body to repair and create new collagen and new structure and create scar healing and repair to make a more smooth, even complexion. Depending on the type of acne scars you have, we may need to use other modalities in order to correct them. There's several different types of modalities that we can use, including subcision, excision, and TCA cross, depending on the type of acne scars you have. So subcision is where we actually go underneath the scar and create injury underneath to lift the tethered down scar tissue, lifting the tissue up, and many times placing either filler or fat to revolumize underneath. Excision is where we actually cut the scar out to create a smaller scar that's easier for us to correct. So TCA cross is what we use for ice pick scars, and what we do is create a very strong chemical peel inside of these tiny little holes to create a closing effect to make them less obvious and smoother in consistency. And many times we need to combine all of these different modalities for different patients to create the effect that they want. So many people ask us why we're now using PRP as an add-on treatment to many of our different protocols. So also, people don't really know what PRP is because it's very new to the scene. So PRP is platelet-rich plasma. What that is we take your blood, we spin it down, and we remove the platelet-rich plasma portion off of it. That portion has growth factors, so when we create microinjury with either a laser or a needling device, we're giving the body healing tools to create a quicker, more robust healing response, and so thus amplify your results in a shorter period of time. So that's really the biggest benefit to using it, and we've seen wonderful results with it. Here at Reflections, we have many different types of laser treatments to accomplish your acne scar goals. Our lasers are good for all skin types, acne scar types, as well as skin colors. So we look forward to having you here to talk about your particular acne scars and come up with a plan to accomplish your goals.